Today, our speaker is Catherine Rodemeyer, who is the Association Director of Communication. She has 30 years of experience in communication and media production. Catherine is studying population health science at the master's level at UMMC and will graduate with a certificate in population health science in May 2022. Catherine, the floor is yours.
Hey, good afternoon, everyone. Hope you are doing well today. I am excited to present this information about health literacy and the patient and physician role when it comes to health literacy. So today's objectives are to define and measure health literacy among participants, explore solutions to help improve health literacy, and offer strategies to help patients with low health literacy. So, have you ever said something and been misunderstood, either in your personal life or at work? I'm sure most of us have experienced a communication breakdown. In your patient communication, has a communication breakdown happened when you are trying to explain the test you're planning to run or a diagnosis, or that the patient's blood sugar is high? Physicians and providers may be providing evidence-based information to the patient, but the patient doesn't have the benefit of the same type of education, or the words may have different meanings in a different cultural context to the patient. Some terms and instructions may be common knowledge to one group, but may be what is called Greek to others. So words do matter, and in the presentation today, I'll provide you with information on how to best reach your audience, the patient. So again, the topics we're going to cover today: what is health literacy? So we're going to define health literacy, personal and organizational health literacy to be exact. We're going to explore solutions to help with the improvement of personal health literacy by looking at the culturally and linguistically appropriate services standards, also known as CLAS. And then we're going to offer strategies to help patients with low health literacy. We're going to learn who is at risk. We're going to talk about plain language, the definitions and techniques about plain language. And we are going to talk about assessing patients' health literacy levels. First, an introduction to the term health literacy. These definitions are from Healthy People 2030, which address both personal health literacy and organizational health literacy. Many skills are needed to function effectively when it comes to healthcare. Health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and for others. So that is what is considered personal health literacy. And then there's organizational health literacy. That is the degree to which organizations equitably enable individuals to find and understand and then use the information and services to inform health-related decisions and actions for themselves and others. So six healthy people objectives, which are developed by the Health Communication and Health Information Technology Work Group, are related to health literacy. So clearly it is an important facet. They are: increase the proportion of adults whose healthcare provider checked their understanding, decrease the proportion of adults who report poor communication with their healthcare provider, increase the proportion of adults whose healthcare providers involved them in decisions as much as they wanted to be involved, and increase the proportion of people who say their online medical record is easy to understand. Oh, and there are two more, I'm sorry. Increase the proportion of adults with limited English proficiency who say their providers explain things clearly, and increase the health literacy of the population in general. So, unfortunately, health literacy is a challenge for most of us in the United States. Only 12% of adults in the United States have a high level of health literacy. That means that, you're dealing with 88% of the US citizens not fully being able to read a doctor's summary, read pamphlets about medication, speak to healthcare providers, listen to and understand doctors and providers, navigate appointment slips. I mean, the list goes on, right? So health literacy is a complex phenomenon that involves skills, knowledge, and expectations that health professionals have of the public's understanding of health information and services. So health information and services are often unfamiliar and complicated. They can be technical, even with people that have high levels of education. And so this transcends age, race, income, education levels. So it's not just people who have limited reading skills or people for whom English is a second language. Many are affected by limited health literacy. So some of the factors contributing to low health literacy are due to social determinants of health. And I'm sure that y'all are all very familiar with social determinants of health. The education, economic stability, poverty pretty much undergirds every determinant of health, the physical or built environment. But there are other contributing factors. For instance, the difficulty of the health information being presented, the culture of the patient. If the patient has a disability, meaning that their hearing and vision abilities may be limited or impaired, the health condition of the patient in general, and the patient's emotions. Having a population with low health literacy leads to health disparities. Health literacy is a social determinant of health, as we have said, and then what I'd like to introduce to you is that health literacy is a shared responsibility. So I have a short video. It runs about 4 minutes long of patients expressing their barriers and whether they are talking about it directly or if you are left to pick up clues to what their education levels are, or what they understood about how the provider's treatment instructions are given. So I'm going to give this a shot.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know this is that twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension and I've been taking care of that for a long time.
Hyper. Hyper.
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper? I have hypertension?
I don't know. That's what I consider it.
Okay.
Being,
Okay. But you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think, I think you're jumping around on the chair or something like that. Something different.
Just being hyper,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension. And that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension to us, same
The
thing.
same thing.
Yeah.
I have a small breakfast and then I take my pills. I usually take 16 every morning. Sometimes it's difficult for me to take these pills because if they say one tablet twice daily, I don't know if they're talking take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning. And this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office and most people, if you realize the first thing you're gonna have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign, never read it. And then a couple weeks later in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
So as you can see, these patients have barriers to doing the things they need to do in order to follow providers' orders, fill out paperwork correctly, and read well enough to know what they are consenting to do, or have the provider do. So that's, as you had seen that. This video is maybe 10 years old, but it's still, I would think, and my guess is that it resonates true today, since our health literacy rates in the US are still low. So all that to say is health literacy is complicated. And it's everyone's responsibility to eliminate health disparities. And this would create better health equity among patient populations. So solutions, let's talk about some solutions. Communication breakdown creates problems for the patient, and by creating more barriers to care. So culture is another dominant factor where communication may be meant one way, but understood another way. This contributes to health inequities and disparities among those who are already vulnerable. So the US government has tried to address these disparities in health literacy by developing a solution, which are standards for providers and health systems that would assist the public. The culturally and linguistically appropriate services standards, also known as CLAS, are intended to advance health equity, improve quality, and help eliminate healthcare disparities by establishing a blueprint for health and healthcare organizations. The blueprint guides organizations on how to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, to preferred languages, to different health literacy levels, and other communication needs of those seeking healthcare. So on the next slide are the intentions of CLAS. According to the U.S. Department of Health and Human Services, class is a way to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities and achieve health equity. Class is about respect and responsiveness, respect of the whole individual, and respond to the individual's health needs and preferences. Culture seems to be a prime mitigating factor for having higher levels of health literacy. Cultural background determines the health literacy levels more so than social class, economic situation, the environment, and race and ethnicity. So the recommendations for individuals and organizations who follow the class standards. So there are some in language assistance and in communication materials and signage. So first, in language assistance, things that organizations can do. So organizations can offer language assistance to individuals who have limited English proficiency and or other communication needs at no cost to them to facilitate timely access to all healthcare and services. They would also inform all individuals of the availability of language assistance services clearly and in the preferred language, verbally and in writing. And organizations could ensure the competence of the individuals providing language assistance, recognizing that the use of untrained individuals or minors as interpreters should be avoided. So in developing the communication materials, your pamphlets, your brochures, your signage, what's recommended is to provide easy to understand print and multimedia materials and signage in the languages commonly used by the populations in your service area. So implementing these standards, especially in communication efforts, can address health literacy levels in populations that you serve. And as we've learned from the Healthy People 2030, helping increase health literacy in Mississippi is everyone's responsibility. So talking about strategies for improving health literacy. Well, the first strategy is to identify who's at risk of having low health literacy. So we'll be getting to know who's at risk now through this discussion. So in Mississippi, there are over 300,000 non-elderly Mississippians who are uninsured. And so that's that is an indicator of someone who may have low health literacy and also may have low insurance literacy as well. Okay, like that barrier to even getting health insurance coverage. However, older adults may be the most affected in that risk group. So on average, adults ages 65 and older have lower health literacy than adults under the age of 65. Low health literacy among older adults is associated with increased reports of poor physical functioning, pain, limitations of daily activities, and poor mental health status. But it can happen to any group, any age group in your community. So another strategy is to explore the language of healthcare, the language you use every day when you're talking with your colleagues and when you're talking with staff, and what plain language is. So the question, how do we break the barrier down and address the concern of being able to communicate clearly with the patient? So one strategy is to use plain language in your communication. Plain language, which is also called plain writing or plain English, is communication that your audience can understand, your English-speaking audience can understand the first time they read or hear it. Using plain language makes it easier for everyone to understand and use health information. Although plain language is a familiar idea, many don't use it as often as they should. So did you know that there's actually a law that the federal government uses around language? It's called the Plain Writing Act of 2010, and it requires federal agencies to train staff and use plain language when they communicate with the public. So here's some tips from the Minnesota Health Literacy Partnership that I think are useful. So when you're speaking and writing, you use an active voice. Use common words. Keep your communication short. Use a positive tone. Say the most important thing first. And in writing, use bulleted lists, headings, subheadings, pictures, and tables. Resources are available to help you with plain language when speaking to patients and when providing print materials. There is a resource called Everyday Words for Public Health Communication. It comes from the Centers for Disease Control and Prevention. And it offers expert recommendations from the CDC's Health Literacy Council and other agency communicators on how to reduce jargon and replace problematic terms to improve comprehension. So we're talking about everyday words. So the Everyday Words publication or tool, I say it's a tool. It provides substitute terms, real life examples of difficult public health passages, revised wording, tips to reinforce meaning and avoid common pitfalls. It's really great. You go to the website, which we can provide these after the presentation. You don't have to copy them down if you would like to have access to them, but it's really good that you can go to the website and type in your word, and the tool will provide an alternate for that word that's in plain language. And so another tool or resource is the Federal Plain Language Guidelines. So the Plain Language Action and Information Network, so it's an acronym, PLAIN, P-L-A-I-N, is a community of federal employees who are dedicated to the idea that citizens deserve clear communication from the government. So this network developed and it continues to revise the federal plain language guidelines by providing updated advice on clear communication. And then third is the National Institutes of Health. They have a plain language guide as well. They've established this clear communication initiative that focuses on achieving health literacy objectives. The page on plain language has information about training and links. And so we'll get those. Those will be made available afterwards as well. So if you were interested in those. So this is kind of a cute cartoon or illustration about just plain language and communication. So the figure on the left is looking at something and is, okay, well, the writing on the paper or whatever is on the paper is attractive enough to, be something that this figure wants to read. And so the understanding of it all, putting it in plain language helps in the communication process from, having the information on the page to it being processed with the person's brain and mind, and then actually having the efficacy to go and take action. So that increases the person's health literacy. So that's really kind of the chain of the behavior change that you want to see with your patients. So just to kind of wrap this in general, when you're talking about communicating with your patients, so first off, you need to know your audience, right? You need to know your audience, like who are you speaking to? Is it a child? Is it a young adult? Is it an elderly person? You would know your audience. And then you would need to fine tune or be clear about your message. What do you want them to do? And then what do they need to know in order to do what you've asked them to do? So that's kind of like where the rubber meets the road, basically. And then you also need to engage your target audiences as reviewers. So this is something that we would love to work with health centers on, as far as like assisting in gathering, maybe consumers of your health center, patients that you see, and encouraging and providing technical assistance on how to get a group together to have them review your materials. Do these materials do you understand them? Are they easy to read? I mean, this is just a very simple kind of small focus group that we would encourage all health centers to consider taking action with and doing, so you know your populations and what communications that you're offering and if they're working, because sometimes they may not be working, and you know we want everybody to be as healthy and well as possible and follow your instructions. Okay, so our third strategy is assessing the patient where they are, figuring out where they are. So this is outside of using plain language, but it's always to assess the patient and meet them where they are at their level of health literacy and to not make assumptions. So there are two instruments that are standard assessments to use to measure the health literacy of a patient. They're the test of functional health literacy in adults, and there's a shorter version that's available of that. The one is pretty long and intensive, and then the other is a shorter version. And then there's another instrument called the Rapid Estimate of Adult Literacy in Medicine. The CDC, CMS, and HHS sites also have resources. So please keep in mind that patients also may need language assistance or assistance in filling out these forms or assessments that you may want to use. So just keep that in mind as well. So now that you've assessed the patient and you have in mind to avoid jargon and to use plain language, taking into cultural considerations and language of the patient and speaking when you're speaking with them, you may have the need to help develop written communication for a patient, for instance, in the after visit summary notes. So very important piece of paper that you take home with you, right? So no matter what the health literacy level of your audience is, written communication should always be brief and to the point, and actionable and engaging. So when you're writing actionable content, it means that you're focusing on behavior. You want to tell the readers or tell the listeners what you want them to do and give them steps to do it. So to review, we've talked about the new 2030 Healthy People definitions of health literacy for individuals and organizations. We talked about the class standards and that we should aim to recognize that we need to use culturally and linguistically appropriate language and images when talking with individual patients and developing communication pieces to have the best chance at reaching the patient with our message and for the patient to successfully follow through on the treatment to take action. So the class standards can help with the improvement of personal health literacy among patients. We also discussed 3 strategies to help patients with lower health literacy rates. They include learning who is at risk for low health literacy, learning about and using plain language in communication, and number 3, to assess the patient for their personal health literacy level. That concludes our presentation today.